If you are dealing with hyperpigmentation on the neck, you need to watch this video. Hyperpigmentation can be a symptom of any number of skin conditions, each with its own specific path to treatment. Number one, melasma. Melasma is an acquired hyperpigmentation, meaning you're not born with it. It's something that you develop usually, maybe in late adolescence, young adulthood. Even older adults can get it. You've probably heard of it, and in most cases when you hear about it, people are talking about melasma on the face, the cheeks, the forehead, but it also can happen on your neck. Grayish blue, dark brown patches with sort of angulated borders. It often is triggered by the hormonal changes of pregnancy in women. In fact, it's often referred to as the mask of pregnancy. Also, medications that are hormonal in nature that you take by mouth or that you put on your skin can also trigger melasma, such as hormonal birth control pills, as well as topical estrogen cream. And of course, sun is a major driving factor for melasma and can trigger it and lead to flares. Furthermore, irritating cosmetics and frequent exposure to heat also can aggravate melasma because there is an underlying component of abnormal blood vessel formation and blood flow. So anything that brings heat to the skin leads to more blood flow, release of inflammatory mediators that push the development of discoloration, hyperpigmentation even further. So how do you go about correcting melasma? See a board-certified dermatologist. It is a complex condition. It's usually not a one-and-done type thing. Oftentimes it requires multiple different treatment approaches, angles, different therapies. While sometimes it can go away, especially, for example, melasma related to pregnancy, sometimes can, resolve once you deliver and be a thing of the past for you. But for other folks, it becomes a chronic relapsing condition. Standard treatments for melasma include topical hydroquinone, as well as something called triple combination cream, which is hydroquinone, an anti-inflammatory, and tretinoin. Of course, sun protection is paramount for improving melasma, as well as being conscious of heat exposure. Really gentle skincare is essential. And again, this is one of those scenarios where you've really got to be very careful and conservative with the stuff that you buy in the store, because using too many products can easily irritate the skin and aggravate melasma. It is a very fickle condition, and a lot of stuff that you might try could end up making it worse for you. So see a board-certified dermatologist if you're dealing with melasma. There are a lot of great treatment approaches, many of which I have covered in my video all about melasma, which is quite an extensive video, so I encourage you to check that out if you're dealing with melasma. Number two, Acanthosis nigricans. Acanthosis nigricans is actually a type of skin thickening. You get these patches that are sort of velvety in texture. Happens on the neck, also under the arms, the sides of the face. It really can happen anywhere. In most cases, Acanthosis nigricans is a sign of insulin resistance. Insulin resistance can be a sign of early type 2 diabetes. It's also associated with a hormonal condition called PCOS, which I have lots of videos about. Rarely, Acanthosis nigricans develops as a manifestation of cancers. This is very rare, and also very rarely it can be associated with certain hereditary disorders. But for the most part, it's a sign of insulin resistance. When we see it, it makes us concerned that the patient might be on their way to developing type 2 diabetes, or they already have type 2 diabetes. Along with type 2 diabetes, if the patient has obesity, that can also be a driving part of the Acanthosis nigricans. Rather than go chasing skincare products, the thing that needs to be addressed is the insulin resistance issue. First and foremost, that is something that needs immediate attention. Provided that the insulin resistance issue is treated, if you have obesity, weight management, these things can make a huge difference in preventing this from getting worse. And in some cases, when things are well controlled, it actually can resolve. Now, in some cases, it becomes a persistent issue and doesn't quite fade to the person's liking, even when their associated metabolic abnormalities are addressed. So there are some things that we can do to improve the appearance of Acanthosis nigricans, including topical tretinoin, provided the person tolerates it, because it can be irritating on the neck. Adapalene shows promise, again, provided the person tolerates it. It's a little less irritating compared to tretinoin. Also, topical ammonium lactate, amlactin lotion, if the person tolerates it, can soften and improve the appearance of Acanthosis nigricans. Individuals have varying success with the triple combination cream I mentioned for melasma, which includes hydroquinone, an anti-inflammatory, and tretinoin. And one of my favorite ingredients also can be beneficial in this situation because it's hydrating and keratolytic, and that is urea. You also can pursue different procedures that can lead to varying degrees of success. Dermabrasion and long pulse alexandrite laser can also sort of debulk and smooth out the Acanthosis nigricans. So those are options. Number 3, atopic dirty neck. Raise your hand if you have atopic dermatitis. Me. Atopic dermatitis, commonly referred to as eczema. It is a skin condition. Often you see in young children, but adults can have it. You know, it can manifest for the first time as an adult. There really are no rules when it comes to atopic dermatitis, but one thing about it, the root cause there is there's a problem with the skin barrier. You lose water more readily, irritating stuff gets in, and you deal with these bouts of very itchy skin. A lot of patients who have atopic dermatitis, once they get to be a teenager, a young adult, people start going, why does your neck look dirty? You get this hyperpigmentation on the front and sides of your neck, kind of has a rippled appearance as it relates to just the natural creases in the skin of the neck. And why patients with atopic dermatitis develop this, who knows? A lot of it is thought to be maybe related to what's called post-inflammatory hyperpigmentation, meaning the eczema, flares up, inflammation leads to an increase in pigment. Not all patients develop this. As with anything, addressing the root cause issue is, of course, paramount. So if the patient's atopic dermatitis is poorly controlled, well, that's going to drive more of the dirty neck appearance. So making sure that their symptoms are controlled, that they are moisturizing consistently, using their medications as dictated by their overall disease severity and needs. No one patient is the same in terms of what treatments are going to end up working out for them, but controlling their condition and reducing the number of flares that they have can help, of course, improve the appearance of the neck and in many cases lead to resolution of the atopic dirty neck. Patients can get varying levels of success with treatments such as topical steroids, a mainstay in atopic dermatitis management, moisturizers to help with the skin barrier and to lubricate the skin surface, reducing the penetration of irritants. And a topical medication we use a lot for patients with atopic dermatitis because in contrast to topical steroids, it's a lot safer to use indefinitely. You kind of have to take a break from topical steroids. But this is called tacrolimus. It is a calcineurin inhibitor, basically fancy terminology for a medication that, kind of silences an abnormally excitable part of the immune system. Many patients with atopic dirty neck, which isn't the nicest name, they actually do quite well with topical tacrolimus. Number 4 is something called Terra Firma Forme. You get these brownish, sometimes black, little spots. Can happen on the sides of the neck, the back. Looks like the skin is dirty. Looks like the patient has not been bathing and they are actually dirty. And this is very distressing to have because you look dirty and people are making comments as people do. But you are not dirty. It's not a hygiene problem, but rather a problem with the skin's kind of maturation and natural shedding. You have an abnormal retention of the skin cells. And the way you can tell if you have this is if you take one of those alcohol prep pads or just a little bit of rubbing alcohol that you dip into a cotton ball, rub it on the area, it'll come right off. In contrast, atopic dirty neck and any of these other things that we were talking about today, they're not gonna just rub off with rubbing alcohol. There are so many quick and easy little tests that we can do as dermatologists to make a wide variety of diagnoses. And this right here, a little alcohol prep pad rubbed to the skin, boom, there's your diagnosis. Easy breezy. Now you guys know about it and you can make the diagnosis yourself. How is this treated? Well, in most cases, patients can get good results using a topical salicylic acid, like a salicylic acid moisturizer, lotion. And in many cases, patients will end up just outgrowing this. It'll burn out on its own. Number 5, CARP sounds like a fish, but it's just an acronym for Confluent and Reticulated Papillomatosis. This is a condition that mostly affects young women, anywhere from age 8 to like your 30s. This can pop up, and it is a fancy name for an acquired condition where you have these little patches of dark brown discoloration that kind of come together, and at the edge of these patches, it looks like a fishing net. Hence the name reticulated, which means net-like. Why patients develop this is an enigma. It's always kind of been thought that maybe it's related to insulin resistance, because a lot of patients with this will also have acanthosis nigricans, they may have skin tags, and they may have PCOS, they may have diabetes. We see that a lot. But it's not always the case that these things are there. So is it that, or is it related to this little bacteria that some people can have on their skin called Tinea? That's kind of one of the working theories as to why patients develop this, either Tinea and or insulin resistance. So if you have this, you know, screen for diabetes is a must, and management accordingly. But because of the possible association with this Tinea, the go-to treatment for this is, well, a course of antibiotics that you take by mouth, usually tetracycline antibiotics, so doxycycline or minocycline. Also, macrolide antibiotics can be used to treat this, azithromycin, clarithromycin, erythromycin. And I gotta tell you, it's one of the most frustrating things to deal with. In my experience treating this condition, you give the antibiotics, clears it up, goes away, and then you can't be on antibiotics indefinitely forever for reasons I've explained on here before. You know, it can mess with your gut microbiome, and you have to start worrying about the emergence of bacterial resistance, and medications have side effects. So anyway, so you put the patient on anywhere from 6 to 12 weeks of an antibiotic, clears it up, and in so many cases, once they stop the antibiotic, several weeks, months later, it comes right back. So the antibiotics are not a cure for it. Magically, for some patients, not all, it just goes away and that's that. But that's the course. Like, I've seen comments from you guys, how to get rid of CARP. Well, antibiotics will clear it up, but they're not a cure. There is no cure that we know of as of now. Number 6. Tinea veriscolor. This is a common skin condition, especially in hot, humid, tropical climates. It's also really common in young people, teenagers, adolescents, tweens. It is related to a little yeast that lives on everyone's skin but can cause a variety of nuisance skin problems for people, and this is one of them. The yeast is called Malassezia or Pityrosporum, but this little yeast thrives in oily, humid, sweaty locations and tends to cause skin problems in times where there's a lot of sweat, maybe in the summer months, or where there's a lot of sebum being produced, maybe as it relates to pubertal changes and your skin is making more oil, or as it relates to things that you may be taking. So, you know, a lot of bodybuilders, for example, may take things legally, illegally, that, you know, in addition to a whole host of side effects, increase their sebum output, which, you know, allows for this little yeast to thrive and jive. And so the yeast causes these little patches that are dark brown, sometimes light pink, depending on your background skin tone, little oval scaly patches. They heal with a hypopigmentation in most cases. And the treatment is antifungals, creams, lotions, shampoos, anti-dandruff shampoos, because they help calm down and reduce the burden of this little yeast, also are used. You go through all of the treatment, it clears up, and then, you know, a year later, you're in a situation where it's hot, sweaty, humid, and it comes right back again. So recurrences are common. So I'm gonna link down below in the description box my video on this condition. I talk all about an approach to maintenance treatment to keep it from coming back. Number 7. Lichen planus pigmentosus, a variant of Lichen planus, often happens on sun-exposed sites like the neck, the forehead, the sides of the face, as well as in the skin folds. And why people get this, we do not know. it tends to mostly happen in people who have a medium to deep skin tone. A lot of cases coming out of India have described associations with certain topicals. Now remember, association does not prove causation, and these topicals, are more widely used there, such as amla oil, mustard seed oil, henna, various hair dyes. Maybe pollution plays a role, it's thought. Also, because it tends to happen in sun-exposed areas, maybe ultraviolet radiation from the sun is a driving force. Do know that you should have a skin exam looking for signs of hair loss, because this often can come along with another condition, which I have a video on, called frontal fibrosing alopecia or Lichen planopilaris, which is, again, a variant of Lichen planus that affects the hair follicle. And patients with, in the case of frontal fibrosing alopecia, they have a receding hairline, prominent, it looks like their forehead is becoming more prominent. They have involvement of their eyebrows as well as other body sites. And if you'll recall from my video on this, it is a scarring type of hair loss. So it needs to be intervened on early to prevent the scarring process, because once the scar forms, the hair will not grow back. But when it comes to the hyperpigmentation, neck, forehead, face, anywhere else, how do you get rid of it? Unfortunately, it is very difficult to control and clear this condition. Varying levels of success with topical retinoids. Tacrolimus, again, as I mentioned earlier for atopics, can also be beneficial here. Topical steroids, because they calm down inflammation. That may be a driving factor here. And then varying levels of success with different types of lasers. And of course, sun protection is paramount for hopefully preventing this from worsening. I wish I had a better answer for how to get rid of this. It is tough. See a board certified dermatologist. There is no single best one and done. This is going to get results treatment. It is trial and error, seeing what works. Number 8. Erythema dyschromicum perstans, otherwise known as ashy dermatosis. I have a whole video on this condition. This is an acquired type of hyperpigmentation where the pigment is down in the dermis. Again, tends to affect people who have deeper skin tones. Involves the face, the chest, the stomach, as well as the neck. Initially, it can have a reddish hue to it, have elevated borders, but with time it kind of takes on this, well, ashy appearance, hence the name ashy dermatosis. This is another condition where treatment is tough, really difficult to get rid of it. The treatment with the highest success rate is a medication used to treat Hansen's disease, which is the name for, well, leprosy. We don't really call it leprosy anymore, but some people are familiar with it by that name. Clofazimine. This is a medication used to treat Hansen's disease. Why it works for this, we don't know. But a lot of patients go on this for this condition and get results. Not everyone, again, it is hit or miss. But that is the treatment with the highest success rate. Other treatment options that have varying levels of success are other oral medications that are used to treat other things, such as oral dapsone, hydroxychloroquine, a medication used to treat malaria, isoniazid, a medication used to treat tuberculosis. Courses of steroids like prednisone can also be helpful in some cases. As far as stuff you put on your skin, some patients get results in terms of subtle improvement with topical steroids, but the outcomes are variable. Also, patients can get some degree of improvement with different laser treatments and with peels, chemical peels. Number 9 is a condition that should be suspected when there is hyperpigmentation on the neck. It's called Riehls melanosis. It's a fancy name for a type of contact dermatitis, a pigmented contact dermatitis. In other words, stuff that you're putting on your skin, on your neck, is causing hyperpigmentation. This can happen as the result of fragrances, dyes in either cosmetics, scented soaps, body care products, perfumes that you spray on your neck, Also can be related to textile dyes in your clothing. There are also some cases that are associated with something called potassium dichromate, which is in leather. So for example, a lot of people may carry a bag, a purse with a leather strap that they do a crossbody action on, and in rare cases, develop a pigmented contact dermatitis that leads to hyperpigmentation on the neck. This condition tends to have a brownish gray appearance, but depending on what is causing it, in some cases it can be a sort of reddish in appearance. This is another one that is tough to treat. First and foremost, whatever the offending contactant is, whether it be a cosmetic, leather, a dye, you have to avoid that 100%, okay? You have to avoid that. Avoiding it alone sometimes might be enough to clear up the problem, depending on how severe it is and how early on in the process you eliminate the offending contactant. Patients with this condition can also get varying success with oral tranexamic acid, which is a medication given to treat melasma, but can also be effective here. And then last but not least is sun damage on the neck can cause hyperpigmentation, specifically a type of sun damage called Poikiloderma of Civatte. This condition does not really happen in people with deeper skin tones. It is more common in people who have paler skin types, Fitzpatrick phototype 1 and 2, people who have skin that is more sensitive to the sun can develop this. It tends to appear more commonly in postmenopausal women, and it includes a constellation of findings that are related to atrophy of the skin, and the skin on the neck is pretty delicate to begin with, and these findings include a mixture of both hyperpigmentation and hypopigmentation, meaning loss of color, as well as prominent dilated blood vessels. The medical term for those is telangiectasias. So you have a lot of little telangiectasias, so it kind of looks red. So you have the red, you have the hyperpigmentation, and so it can kind of look reddish brownish. Poikiloderma of Civatte not only affects the neck, but in some cases can occur on the upper chest as well as the lower face. It's typically without any symptoms, but for some patients, it can burn, sting, and patients may also experience bouts of flushing in the area. It's tough to treat. It is tough to treat. Sun protection is paramount. You're not going to get anywhere if you try and treat this, yet continue to not protect your skin from the sun. Avoiding use of perfumes, scented soaps, cosmetics with fragrance on the neck is also recommended because the skin is more sensitive and fragrance can be a contributing factor here. Because of the positive effects that topical retinoids can have on the deeper layers of the skin and with hyperpigmentation specifically, provided the patient tolerates them, topical retinoids can be useful, but that is a big caveat because again, retinoids on the neck can be more irritating, and anything that causes more irritation can actually worsen hyperpigmentation in the long run. Furthermore, a lot of patients derive some benefit from a topical alpha hydroxy acid, such as glycolic acid, lactic acid, which can help reduce the brown discoloration, provided you tolerate it. Again, pulse dye laser treatment can be pretty helpful in improving the appearance of Poikiloderma of Civatte because it will help target the telangiectasias as well as the dark spots. And then fractional non-ablative lasers can also lead to some improvement in the appearance of Poikiloderma of Civatte, but do know that this condition is irreversible and very stubborn and resistant to many treatments. So protect your neck from the sun. All right, guys, those are 10 causes of hyperpigmentation on the neck. Hopefully this video has left you with some insight into the complexities of addressing discoloration really anywhere on the body, but specifically in this context on the neck. This is by no means a comprehensive, all-inclusive list of every single thing on earth that can cause hyperpigmentation on the neck, but these are 10 things that come to mind that should be considered when dealing with hyperpigmentation on the neck and the treatment approaches to each of these. I really hope you guys found this video useful. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sun sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.